opinion about the impact that morbid mortality has on the patients, about the cuttings on nursery here in Spain?
So, from a European perspective, in general, what we have seen is that there has been a lot of cuts in member states' budgets on healthcare, and particularly cuts healthcare workforce, cuts on pensions, cuts in primary care, cuts on entitlements for patients. So what we've tried to encourage is that member states have another approach and a more broader try to invest in health in a more sustainable way. So we've issued various papers on that, and member states as well. Our commissioner was in Madrid in October, and this is the message he gave to the Spanish authorities, is to try to use the crisis as also an opportunity for more jobs and growth development in Spain. And so that could be in the nursing sector, in trainings, in trying to give more upskilling or more skills to the workforce already, so that they can, for example, deal with multimorbidity in a more sustainable in a sustainable way. So and we in the Commission are supporting a joint action on chronic diseases. So which is being led by Spain, by the Carlos Tresero, which will begin in January. So that is a €5 million project, and it's a joint action and covers many member states as well. So that, and as Spain is leading, they're in a good position as well.
And what about the rate between nurse and patient versus doctor-patient? Are very different in Spain from other European countries. In Spain, each time we got few nurses to attend patients. And what do you think about these differences between European countries?
So I think we're in Europe. When we're looking at the care sector, and you can see that in how we're designing our future funding programs and how we design our health program, is that we're trying to emphasize self-management, we're trying to emphasize patient empowerment more, we're trying to promote, say, electronic healthcare, sharing records, so that actually less of the responsibility is on the doctors and it's being more balanced across the care sector. Because originally how the care system was designed, it's always just the doctor who is the primary, but now what our approach is moving towards ideas such as community-based management, where nurses would be leading with persons with dementia, involving physiotherapists, in a more community care approach, where doctors are part of it, pharmacists are a part, but it's not essentially now a doctor-oriented care system.
And at this moment of economic crisis in Spain, especially in Spain, how do you think that research can influence in health in general, and also especially research in caring?
Well, I think a lot can be done and a lot can be achieved if we invest in healthcare research. And what we're promoting via our Horizon 2020 or public health programs, and also via structural funds, where we're promoting that member states invest in health in structural funds as well, is to build on already good practices that are in member states, to try to build an evidence headspace on that, to monitor, evaluate, try to test the solutions, not only in the member state where it is, but elsewhere, so that there could be a market for this or this sort of system. So we expect then that by collaborating on a European scale and not just on a local or regional scale, that you would see faster, quicker results as well, but also cost savings, and possibly programs that do create jobs or that retain jobs as well. So there would be a lot of potential if we invest more in healthcare research.
Okay, and finally, what do you think about the situation in Spain where many nurses have to go abroad to work because they cannot work here even? They are very well prepared because there's no job for them.
Yeah, I think So I just more focus on the EU side, so I'm not the expert on Spain. If that would be from the member states who come, and they should relay this message to Europe when they come, that there is issues in Spain with their workforce, that they have oversupply of nurses, it doesn't meet the demand. So I think I mentioned that we have an action plan on healthcare workforce, and we're looking to match supply and demand in the future as well, so that there isn't this gap. So I think Spain is not alone in that side. It's similar in Portugal, it's a similar case there. Whereas in the NHS system in England, there would be a huge demand for nurses, as they don't. So they would be meeting it, but I think in Europe it's a more European workforce scheme. We'll be funding projects looking at that as well, and ensuring that this gap isn't so big for member states as well.
Okay, thank you very much.
Okay. Very